It usually starts with a sudden, sharp sting. You're in the middle of a busy workday, walking down a hallway, and out of nowhere, an intense internal burning derails your entire afternoon. That sharp pain marks a standard urinary tract infection, or UTI, a bacterial invasion where microbes take hold inside the urethra or the bladder and trigger an aggressive inflammatory response. For many women, the most frustrating part of that sudden burning sensation is the timing. You might have just finished a round of antibiotics for this exact same problem a few months ago. Clinically, if you experience 2 infections within a 6-month window or 3 over the course of a year, you meet the threshold for a recurrent UTI. When you're busy and the pain is escalating by the hour, scheduling another doctor's appointment feels impossible. So you reach into the back of your medicine cabinet, grab a few leftover antibiotic pills from a previous prescription, and hope they take the edge off. Taking a few spare pills might numb the immediate burning, but it leaves the underlying vulnerability completely unaddressed. Self-medicating a recurrent infection masks the problem, trapping you in an escalating cycle of temporary relief and inevitable painful returns. To understand why certain people get caught in this loop, we have to look closely at anatomy. Women are highly susceptible to UTIs, largely because the female urethra is very short and sits in close physical proximity to the anal region, compared to the much longer structure of male anatomy. This short physical distance provides a fast track for common gut bacteria, like E. coli. They migrate away from the perianal area, easily ascend the short urethral pathway, and embed themselves directly into the walls of the normally sterile bladder. Once the bacteria colonize a bladder wall, the immune system reacts. This localized battle causes the classic symptoms: severe urinary urgency, a cloudy appearance to the urine, a persistent burning sensation, and aching pain in the lower belly. While those symptoms are highly uncomfortable, there are clinical red flags that indicate a much deeper problem. If that burning is suddenly accompanied by a high fever, severe chills, or sharp pain in the side or middle back, the bacteria have breached the bladder entirely and are ascending the ureters toward the kidneys. Recognizing those red flags is critical. A localized bladder infection is a frustrating annoyance, but an infection that reaches the kidneys, called pyelonephritis, is a severe systemic crisis that requires immediate, aggressive medical intervention. Recurrent bladder infections are driven by specific internal systemic shifts or mechanical blockages that provide bacteria with a persistent biological advantage. For example, hormonal shifts play a massive role. During menopause, dropping estrogen levels significantly alter the vaginal microbiome. This estrogen drop depletes the natural protective bacteria that normally keep the local environment slightly acidic, removing a primary biological defense against E. coli. Mechanical vulnerabilities also create perfect breeding grounds. Conditions like kidney stones, diabetes, or even minor structural issues that prevent the bladder from emptying completely leave small stagnant pools of urine behind. Bacteria rapidly multiply in these stagnant pools. Medical data consistently debunks the pervasive cultural myth that UTIs stem from poor personal hygiene. Recurrent infections routinely happen to highly hygienic individuals because these underlying biological and anatomical factors dictate the body's susceptibility. The same clinical data also debunks the popular cranberry juice cure-all. While certain compounds in cranberry concentrates might help prevent bacteria from adhering to the bladder wall in the first place, they do not possess the antimicrobial power required to eradicate an active, established infection. Viewing a UTI as a personal hygiene failure or trying to cure an active infection with juice only delays real treatment. It keeps patients out of the doctor's office, preventing them from identifying and treating the actual biological triggers causing the recurrences. This brings us back to those leftover pills in the medicine cabinet. When you take an incomplete or incorrect dose of antibiotics, you only kill off the weakest bacteria. The surviving cells rapidly multiply, passing on genetic traits that allow them to build resilient defenses against that specific drug. Guessing your own treatment actively breeds antibiotic resistance. You are inadvertently training superbugs in your own urinary tract, which renders frontline antibiotics completely useless when a future, potentially more serious infection strikes. The first necessary step to break the cycle is getting a professional urine culture. A lab analysis identifies the exact bacterial strain causing your discomfort and, crucially, tests its specific vulnerabilities to figure out exactly which antibiotic will destroy it. By utilizing targeted diagnostics, you stop blindly throwing random chemicals at your body. You shift from a guessing game to strategically eliminating the specific pathogen that is causing the problem. This clinical flowchart illustrates the exact algorithm physicians use to stop the recurrent cycle. Notice how they start at the top with initial prevention approaches and move down toward an antibiotic-sparing strategy. Doctors prioritize non-antibiotic solutions first, avoiding the side effects of daily antibiotic prophylaxis. Based on this algorithm, a doctor will outline evidence-based behavioral defenses you can start immediately. This includes drinking 2 to 3 liters of fluid daily to continuously flush the system, refusing to hold your urine when you feel the urge, and voiding shortly after sexual activity to clear out any stray bacteria. From there, they can prescribe targeted medical interventions tailored to your specific demographics. For postmenopausal women, a highly effective option is topical vaginal estrogen, which safely restores the local microbiome and rebuilds the body's natural bacterial defenses without relying on oral antibiotics. Frequent UTIs are a highly solvable medical condition. By partnering with a healthcare provider and utilizing diagnostic testing, rather than suffering in silence with leftover pills, you can permanently break the cycle and reclaim your quality of life.